All right, let's attend to this now. Deputy President Paul Mashatile will deliver a keynote address at the opening of the 11th AIDS Conference in Durban tomorrow by virtue of his position. Mashatile is also chairperson of the South African National AIDS Council. This year's four-day gathering will be observed under the theme Act, Connect and End the Epidemic. Dr. Thato Chidarikire, chairperson of the 11th AIDS Conference, joins us now for more on this conversation. Dr. Thato, good to have you, and thank you very much for coming on tonight. Just put us into the picture what the conference, the four-day gathering, seeks to identify some of the key objectives of coming together.
Thank you very much. Good evening, and good evening to the viewers. So the 11th SAA's conference, under the theme, as you've said, Act, Connect and End the Epidemic, seeks to bring together, the HIV community, people living with HIV, the researchers, the scientists, governments, non-governmental organizations, as well as, development partners, civil society sectors, everybody, just to reconnect and come back and bring the HIV and TB epidemics back into the spotlight. We may remember that the last conference was virtual in 2021 because of COVID-19. So this really is the first one since 2019 that is fully face-to-face.
Yeah. So if we were to take stock, for example, of where we are post COVID-19, as far as you put it up, the pandemic of HIV, AIDS and TB in South Africa, and how we've been responding, how would you assess our performance?
We've come a long way. We've had challenges, but we really have managed to move through. As much as South Africa is a country that has the highest burden of HIV, the highest number of people living with HIV in a country. But we really have come a long way in that, while we acknowledge that 2020, 2021 were not very good years because of the COVID-19 pandemic. But what we have learned from COVID-19 is that we need to bring services to the people. We need to integrate HIV services into primary health care. We need to ensure that we introduce self-care interventions where individuals may not necessarily have to go to a clinic if they are not sick, but they should be able to actually take care of themselves. For example, HIV self-screening. One can actually screen themselves at home or outside a facility, and only if they screen reactive, which is usually or positive, then they can go to a clinic. So those are the things that we have learned, from COVID-19. And while we know that the prevalence remains, it's about 14%, which is almost 8 million people. And that's really the number of people living with HIV. And people are living longer because of treatment. But the incidence, which is new infections, is really going down. It may not be going down at the rate that we want it to, but there are prevention interventions that we have introduced that seem to be working in combination, of course. Thank you.
So the last time, as you mentioned, the AIDS conference was, of course, held virtually. And part of the conversations that we had with some of the stakeholders, and a worrying one for that matter in the African continent, is there large number of new infections happening in young women in Africa. What are we getting wrong there?
The main challenges, in terms of the research of the household survey that we had through HSRC, is that young people, especially adolescent girls and young women of the age 15 to 24, remain at a higher burden of HIV, almost 3 times as compared to their counterparts, males, in terms of the same age. And mainly, you'll find that what we have seen is that young women then would have early sexual debut, that they start their sexual acts at a very early age. There is a challenge of multiple concurrent sexual relationships. There's also low condom use, which is usually attributed to, a lot of the times, lack of ability to negotiate safer sex, in terms of condoms, as well as low access or use of other prevention interventions that we have, like PrEP. We have PrEP, which is also a prevention intervention. So all of that put together and also are compounded by multiple sexual partners, compounded by having sexual relationships with older men, actually increases the incidence of new infections in young women as compared to young men.
We were talking also the last time about technologies coming in because, of course, we were dealing with COVID-19 and there was the introduction of new technologies such as mRNA and how that certainly could be used, or we could tap into that to improve penetration as far as TB vaccines is concerned. And there was also some positive, I suppose, hopeful aspirations of even maybe looking at that platform creating something as important as an HIV vaccine, which we do not have currently. Are we moving in as far as that is concerned?
This is also one of the tracks that we will have in the current conference. You know, we follow the science. We have a track that talks to implementation science, that will talk to how far we are. We also have a track on basic and clinical sciences that talks to the clinical studies. We talk about vaccines. We are winning when it comes to preventative vaccines. You know, we have a PrEP injectable, cabotegravir long-acting injectable, that will be rolled out once there are all the regulatory approvals in South Africa. It's been approved by SAPRA already. But when it comes to HIV and its cure, I think we have all learned that the virus, HIV, is a bit of a tricky virus, being a retrovirus. But science is actually working, and we are moving, and we are having advances. And some of these results we will be able to get in the conference as it starts as of tomorrow.
So who will be on this platform?
We have, I would say that we have 7 tracks in terms of the conference, and we will be talking about epidemiology and pandemics. We're going to be talking about basic and clinical sciences, social and behavioral sciences, implementation science. So we're going to have scientists, we're going to have researchers, we're going to have clinical scientists or clinicians as well as our social and behavioral scientists. As I said earlier, we're bringing together everyone who works with HIV, including governments, developmental partners, because we also need to ensure that we have also leadership, political leadership, as well as funding. So everyone is now coming back to act again and reconnect, looking back at what COVID-19 did to ensure that we make progress. And I mean, the time is now. We need to act now and put this epidemic to rest once and for all.
Dr. Chidarikire, much appreciated. Thank you so much for coming on tonight. That's Dr. Thato Chidarikire, the chairperson of the 11th AIDS Conference.